Hello and welcome to 360 Back and Spine Center. I'm Dr. Melanie Kinchen, the founder, where we're here to navigate your back to health. Come, take a look inside. Most physicians, and certainly most surgeons, they see it's a disc herniation, I'm going to do this surgery. But to me, I look at it, it's a disc herniation, but it's a person that has a disc herniation. This person might be the construction worker that can't afford to take 6 months off to wait to see if the disc gets better on its own, and he wants to have surgery quickly. And the other person with a disc herniation might be an older lady that is really deathly afraid of surgery because she can't take any time off because she's caring for her sick husband at home. And I think a good surgeon understands the dynamics of both. You help guide the patient to the decision that's right for them. Well, I certainly grew up thinking that I could do it all. My grandmother actually emphasized that anything was possible through an education, and she sacrificed tremendously to send me to the best schools so that I would be able to have the opportunities that I would otherwise not have had. So I picked probably the hardest profession in medicine for women, which is orthopedic spine surgery. As a person that always was kind of just outside, it didn't bother me because I felt like I could be successful, I can do anything. Dr. Kostwick, he's a world-renowned spinal surgeon, and people would come from all over the world to watch him. I was doing my 4th year residency, and he actually asked if I would do his fellowship. It was a coveted position to be his first assist, and he would always pick me. When I first came to Texas, I really came to be a deformity surgeon. That's what I did in California for the first 10 years of my practice. When I was going out on my own here, I wanted to recreate that same type of environment that I had in California. And the focus really was helping educate the patients to make the right decision for them. And that's actually my mantra, really, of my practice, which is navigating your spine back to health. 360 Back and Spine Center, it's BASC, Badass Spine Crew. That's really where that came from. My whole team travels with me to every hospital I go to. The 360 part is kind of a play on words. So 360 is a type of spine surgery. It's where we go in through the front of the spine and we go in through the back of the spine. When I approach things, I'm looking at it from a different perspective. What else is going on in this patient's life? Are they going to be able to take 3 months off work? I mean, that's not really the best solution for them. They're taking care of their sick relative at home. They're not going to be able to have a 5-level fusion and get back to that. That all matters. And I care about that. That's important. I went to Harvard Medical School. So I learned medicine, kind of one of the premier institutions in the country. And then I trained at Johns Hopkins, which of course is one of the most elite universities in the country. And I learned from the master of spinal deformity surgery how to do spinal deformity. So when it comes to training, there are very few that have that background and my level of caring. I think I have a great ability to help people understand their problem and then guide them to what solution would be the best for them.